Hello everyone, I'm Professor Dr. Amina Muazzam, working as Director Research and Chairperson Department of Applied Psychology, Lahore College for Women University, Pakistan. I'm sure many of you would have heard about my country. Pakistan is a beautiful place, but like all over the world, as COVID has really hit hard on everyone across the globe, COVID has definitely impacted to Pakistan and especially to Pakistani women. Because my topic of concern to talk about impact of COVID-19 on women in Pakistan, so I will be largely focused on particularly women. COVID-19 in Pakistan was absolutely as harsh as it has been to many other countries. But I believe that much like other countries across the globe, there is growing realization of significant threat. The new coronavirus poses to Pakistan population of 222 million, about half of whom are women. But the challenges, the opportunities, the problems which is being faced by Pakistani women were probably different as compared to the many other part of the world because of its geographical location, because of its being a conservative cultural society, because of being many other social and psychological reasons, because of some economical and geopolitical reasons. We cannot undermine that challenges were really special in nature. Past outbreaks and humanitarian crises have demonstrated that men and women are impacted differently. So same is the case with Pakistan. Women, especially women with disabilities and young women, and transgender persons suffer disproportionately due to the unequal gender and power relations that determine access to and control over their, many other personal restrictions. As we understand that in, general scenarios, these, vulnerable groups, especially the transgenders, the non-binary, then women and especially young women and women with disabilities, they are very, sensitive populations of Pakistan. And when it comes to COVID, their challenges become even unique. Pakistan has adopted numerous laws that legislate equality-based principles. It's not like the case that we don't have any law, we don't have any rule, we don't have any, specific principle to deal with certain things. But perhaps one of the most notably, the Constitution of Pakistan provides for the fundamental rights of all its citizens, including establishing that all persons are equal before law and entitled to the equal protection of law, and states that there should be no discrimination on basis of sex. The Constitution also calls for steps to ensure the full participation of women in all spheres of national life. That is the Article 34. But besides having everything being written into the law, the things on the surface and grounds are not as they are supposed to be. They are different. When we see the practical implementation of law, we see that the law enforcement companies are probably not that strong enough to make ensure that the people and the women in Pakistan and all the vulnerable groups are actually getting the rights as they are being stated by the law. Despite these legal frameworks, however, weak governance systems, as I just rightly mentioned, and lack of enforcement of legal instruments undermine access to rights, particularly for vulnerable groups. This reality means all preparedness and response measures should incorporate a strong gender analysis. So the empirical evidence regarding the extent and scope of gender differential impact of COVID-19 in Pakistan is yet to be established. It is particularly maybe taking some other few years in which we will be able to, talk about some differential impact of COVID in Pakistan. But women and most marginalized community will likely experience disproportionate hardship from this crisis. These are the result of the Shan research, an indigenous researcher from Pakistan in 2018. There are few important areas to consider for better and understanding of the impact of COVID-19 on women. First, I would like to talk about local government representation and participation. To implement the National Action Plan, a number of committees have been set up in Pakistan. However, these committees are dominated by men with negligible representation from women. So you can understand when those who are taking decision, those who are looking, at different point of view and angles, are not the one who is suffering from probably their, ideology, their, decisions, their, point of view would not be a true representation. Nationwide, an outline in the figure I will be showing you in the next slide, women represent only 5.5% of the COVID-19 committees, and it reflects a broader issue with low level of women representation from senior government officials and decision making positions. And this is the report which was being published by Democracy Reporting International Pakistan 2020. So look at this figure. There's the women as proportion of committee representation. On the top of the blue highlighted area, I have mentioned different provinces of Pakistan. The first one is the Islamabad, which is the capital territory. Then Punjab, which is one of the largest province in terms of population. Then Sindh, then Khyber Pakhtunkhwa, and then Balochistan, which is largest by area, but there is very lot of disparity in that area, with there many kind of tribes, living all together in Balochistan and its larger part, and then overall Pakistan. So here you can clearly see, then when we see the number of the women in COVID-19 response committees, they are only 5 in Islamabad, which is supposed to be the most cultured, most polished, most well-educated, most well-represented, part of the Pakistan. And men in COVID-19 response committees in lieu to 5 is 68. There is a huge disparity with this number, and we don't have any explanation for that, except that yes, the women are unable to get the true representation. Then in the Punjab, probably we can see that it's the most literate, province. The number is 7 in response to the men in number 62. In Sindh, we have only 1 woman in response to the 9 men in, committee. In Khyber Pakhtunkhwa, the gap is so huge and wide that there is only 1 woman in comparison to 52 men. When we talk about Balochistan, it's not only alarming, it's threatening that there are only 0 number of women representation and 62 men in, as compared to the 0 women are the representative of different, COVID committees. So in Pakistan, totally we see that as compared to 253 men, there are only 14 women who are representing COVID-19 response committees. Now, when we talk about COVID, there are these very much challenging issues which are particularly related to women. When we talk about menstrual hygiene, when we talk about issues related to delivery, when we talk about child and maternal health, when we talk about exclusive all those issues which only men face, like women face, like when we talk about the issues related to menopause. So, there are n number of such issues in which when we see that only women can think about that how they can, support another woman in a challenging situation, which is, COVID-19, and how to provide, access to basic health care to those women who cannot, go far by themselves, because COVID-19, even to commute from one place to another was a big challenge, rather than it's supposed to be in normal days, because people were not comfortable sitting in a one bus and one small van where people are congested,ly sitting. So how they can get access to these facilities? So probably in a country like us, where harassment and bullying are very much common, and gender-based violence is very much common, statistics prevailing toward gender-based violence is very high. We cannot assume that the representation of this large number of men is justified by any means as compared to the very low number of the women who are representing themselves. So by building up the case, my argument is that women are genuinely the sufferer in this case, even if there is one particular issue we are looking into during the COVID-19, not even if the overall general sphere of life. Then talking about the economic uncertainty, women with economic uncertainty, informal jobs, which account for most of the women employment, have been first to go. So, what are those informal jobs in Pakistan? Probably the women who belong to the low socioeconomic status generally works in village vegetable markets where they you just separate good vegetables from the vegetables which are nearly to be perished, and they make them separate and they sell them accordingly. Then there's a lot of work which informally women do, like they do the household cleaning for other people on very minimum wages. They just wash clothes and do laundry of other people, or they cook food for other people, and they were doing babysitting for other people, and many other things like that, which do not have even a formal pay structure, and they do not get any license and any work permit for that, but they are just doing these works. This is very much common in Asian region that people do, in most of the Asian countries, that people do work like this. So their informal jobs were first to go. Then most women informal workers, especially those based at home, have lost their source of income during to COVID-19. Like if you were, doing a stitching, having a stitching unit at your home and you were stitching, that stitching unit was of no use in COVID because no one was buying clothes, no one was going outside, no one was concerned about wearing something good because they were even more concerned about their health. So, with children at home during lockdowns, women were also shouldering most of the care work, further reducing their economic opportunities because children were not going to school, they were staying at home, and women were the one who have to take care of the children as well. Over a quarter of Pakistani women have been fired or suspended from their jobs in various sectors. This was one of the recent research published by one of a Pakistani researcher. Then unpaid work is its impact on education. It is important to note that in addition to the unpaid work, this is something very very important to note that women unpaid work is increasing during the pandemic with potentially negative implications on long-term educational outcomes. Despite this, Pakistani women have remained at the forefront of all efforts to fight with the pandemic. More than three-fourths of all employees in the country's health sector are the women. Whether they are, the nurses, they are the doctors, they are the paramedical staff, and they are the any other kind of support staff, they all are women. It has now become abundantly clear that health and economic shocks of COVID-19 pandemic has been accompanied by the worst gender inequalities. Now, this is one of the graphs which shows gender inequality across the world, and you can see that gender inequality index value is being representative here, and it focuses that how gender education work and other areas of life has been disturbed. So moving forward about this. Violence against women. So when I talk about violence against women, it's a major public health problem and violation of women human rights. Such violence is being observed by excavated during the COVID-19 crisis. On April 6, the UN General Secretary noted a horrifying global surge in domestic violence linked to the lockdowns imposed by government responding to the COVID-19 pandemics and linked concern about women's access to essential support services for gender-based violence. We understand that this was a very difficult time for everyone to stay inside the home. And when you spend all the time in one place with having no, activity and with a distressed mind, that can, become a problem. And all those who are having any kind of, issues related to their mental health, as a psychologist, I can claim, they can use their, vulnerabilities to other women, other people, especially women, in terms of violence. So increased household burden was a deeply gendered phenomena. Despite men spending more time at home during COVID-19 lockdown, the burden seems to be doubled. And most of the women said that they are now spending more time in cooking. They are doing more time in cleaning and caring for children and elders within the home than they did before the pandemic. Now looking into the access of healthcare facilities. Women access to healthcare facilities also seems to have constrained during the pandemic. More than 1 in 3 of the women who needed pre or postnatal care in household during the pandemic did not visit a doctor or a hospital. This was the research I did with my co-collaborator Dr. Jaffrey in 2021. And most of them said that this was because lockdown limited their mobility. As I earlier mentioned, that the transportation was a huge issue, and because of a lack of the money or because of the fear of the virus. Then care for caregiver. Now, women constitute almost 70% of the frontline health workers, including lady health workers, community midwives, nurses, and a considerable number of female doctors. In Pakistan, these health workers, in absence of proper safety gears and health facilities, lack of preparedness, are at a heightened risk of infection when compared to the rest of the population. I have this personal experience. During this COVID, I lost my mother due to COVID-19. And when I was taking care of her during the hospital days, I have seen many doctors who were, full of their energy, heart. They were helping the patients, their, caregivers. They were looking after the wards full of COVID-19 patients. But most of them were not equipped with proper gears which they need to wear. And that was the reason that many of the doctors lost their life during COVID-19 because of not being facilitated properly. And by the time the proper equipment, the proper gears and jackets were reached, most of them, before wearing any safety kits, were exposed to COVID-19. Psychosocial support for individuals who have been have been working in extremely stressful environment during the last couple of years. So, that was really a very harsh time. Now talking about the mental health. Women are the most susceptible to mental health disorders and have been reported to experience higher level of depression and anxiety during previous large-scale disease outbreak. So stressful event like COVID-19 pandemic can add extra burdens to women already mal-affected lives. So we can understand that during this time, the panic, the anxiety, and many other issues were, raised because of lockdown, travel restriction, and suspension of educational institutions. I also believe that one of the very important thing is limited access to technology because, the world has become digital. But was a severe digital divide by gender in Pakistan. According to the 2018 Global Digital Report, women are 37% less likely than men to own a mobile phone and have internet access, especially in rural area. So this limited access to technology further limit their access to a COVID-19 awareness campaign in social media and important information about their health and relief measures which are being offered by the state. Now, I would quickly like to discuss some of the key recommendations which I find that they are very important to be shared at a global perspective, at a larger level. So, a few of them are the greater representation of women in COVID-19 in decision-making committee is one of the very, very important recommendation which I propose. Then strengthening educational outreach on reporting channels and services for survivors of domestic violence. This is very important that to ensure that such services are sufficiently funded through COVID-19 period and beyond that. During COVID-19, I was, from my educational institute, I was leading a campaign which was, e-telecom health campaign, and we were providing counseling services, online counseling services to people across Pakistan. And during the time period of just the beginning of the 3 to 4 months, I received 1,340 calls across Pakistan, and people were, asking from very, very small questions to very serious questions. And I think we really need to strengthen this thing that how we can provide access and information to people while sitting at their home in such crisis situation. Now, working with civil society partners is very important because assessment on differential impact of COVID-19 on women cannot be done without their help. And then collaborative work in business sector is needed to respond to the crisis in a way that not only consider women but also help transform unequal gender roles. In the short, this would include women's equal participation and voice in planning and executed crisis response. It is extremely important to improve the outreach of awareness activities. Without any doubt, it's very much important. Government should take serious steps to stop violence against women. Access to shelters, hotlines, online counseling, and psychosocial support systems are needed more than now ever before. Then, the way I would like to conclude it is with the future uncertain as a result of COVID-19 pandemic, we don't know how many waves more to come. There is also an opportunity for a renewed focus on rights for all and implementing improved right-based measures that apply not only to immediate pandemic but to broader societal shift that lasts for decades to come. Events of this magnitude have yielded incredible suffering and also incredible innovation and social change. It is possible that Pakistan and the world more broadly, after social isolation and the shock of the pandemic, will look dramatically different. To harness this opportunity, it is imperative that the government consider and plan for the long-term impact this pandemic may have on women, including women from at-risk groups such as young women, women with disabilities, and women from rural or more conservative households. It is important work towards minimizing these consequences by further investigating and aligning existing policies and programs to safeguard and promote marginalized groups' access to democratic rights and COVID-19 response mechanism. Last but not the least, I would like to say that COVID-19 has changed this world. COVID-19 has not only changed Pakistan and Asia, it has changed the whole world, and we should get ourselves prepared to, engage ourselves in this newly developed world after COVID-19. So, for any questions and queries, feel free to email me at aminamuazzam3@gmail.com. With this, I would like to take leave. Thank you very much for listening to my presentation.